presenting this special edition tracking COVID-19, wherein we get you all the updates and developments related to the pandemic. Even as you all stay indoors following the self-quarantine norms, we get you this special edition each day. We get you international updates, we get you ground reports, inputs from reporters, and also words of advice coming in from the doctors, and lots more to keep you abreast with the latest happening around you related to COVID-19. So let's get started with the headlines first. Ministry of Home Affairs issues order to states and union territories to allow opening of certain categories of shops except those in single and multi-brand malls. Relaxations and lockdown restrictions would not be applicable in hotspots and containment zones. Mandatory for all permitted shops to open only with 50% strength of workers. Ensure compulsory wearing of masks and strict adherence to social distancing norms. No new COVID-19 case reported from 80 districts in the last 14 days. NCDC says COVID growth rate reduced due to timely lockdown. 9.45 lakh people put on disease surveillance system. Active coronavirus cases in India rise to 18,668 with 775 fatalities and 5,062 recoveries. Results of limited trials of plasma therapy begin showing positive results in selected hospitals across India. Encouraging initial results give a ray of hope to seriously ill coronavirus patients. ICMR recently allowed states to start clinical trials. Global cases of COVID-19 continue to spiral up with nearly 27.9 lakh confirmed cases and 1.95 lakh deaths. WHO announces landmark collaboration to speed development of safe, effective drugs, tests and vaccines to prevent, diagnose and treat COVID-19. So those were the headlines. Up next, we'll take stock of the developments in India in our segment Ground Zero. Talking of the COVID-19 update in India, as of the latest update of Ministry of Health and Family Welfare, the country has recorded a total of 24,506 positive cases, which includes 18,668 active cases. 5,062 cases were fully recovered and discharged from hospitals, while the death toll reached 775 in the country. Maharashtra continues to remain in the worst hit state category in the total number of infected cases, followed by Gujarat. Delhi is occupying the third position with more than 2,500 positive cases. 7 states, including Uttar Pradesh, Tamil Nadu, have crossed the 1,000 mark. And when we talk of the state-wise breakup of the COVID-19 outbreak in the country, we will get you the state-wise breakup as well. Different states have been reporting different cases of COVID-19. When we talk of the cases, we'll get that in a while from now. Or before we head on to other news, let's get you the cases. Behind me are the active cases, and here on your screens, we have the map which talks of the state-wise breakup. The first state we see is Maharashtra. Confirmed cases are 6,817. Out of these, 5,676 are active cases. There have been 840 recoveries and 301 fatalities have been reported from the state of Maharashtra. After this, we go across to the next state, And from here, when we talk of the next state we pick up in the country, we will get that detail and we will get that statistical data just in a bit from now. But when we talk of the total number of the COVID-19 cases, as of now, we see that the cases have crossed 25,000 mark, and more than 5,000 have been the recoveries. And here we have the details of the state of Maharashtra with 6,817 confirmed cases. And when we talk of out of these, 5,676 are the active cases. 301 fatalities have been reported and 840 have been the recoveries. Apart from showing you the statistical data, time and again we have been repeatedly showing you the recoveries also which have been made when we talk of the outbreak of the pandemic, and that is only possible if you yourself take precautions and follow the guidelines which have been put forth by the doctors, by the center. Time and again we have also been reminding you of keeping yourself self-isolated and also ensuring that you follow the guidelines, you keep yourself clean and maintain personal hygiene. Wash your hands time and again for 20 seconds. When you wash your hands, make sure you clean your hands properly. While washing your hands, make sure you clean the palm, the backside of your hands, and also don't forget to clean the web of your hands. That is also very important. Added to that, make sure if soap and water is not readily available, you have sanitizer with you. Keep using sanitizers time and again, and also wear mask, wear gloves, and that is how you can keep yourself protected and you can help in prevention of the spread of the disease. Remember, prevention is the best precaution you can take, and this is the way we can keep this pandemic, this outbreak of COVID-19 at bay in the country. Talking more about it, the number of districts where no case has been reported in the last 14 days has increased to 80. In 36 districts, there has been no case for the last 28 days. The recovery rate has also seen an upward trend. 20.75% is the new rate of recovery of corona patients. The doubling rate has also improved with awareness and social distancing in practice. Now the total cases of corona infections are doubling in 8.6 days, while the earlier figure was 7. The Union Ministry of Health and Family Welfare said on Friday that its robust surveillance system is closely monitoring around 9.45 lakh suspected COVID-19 cases across the country. And the Ministry of Home Affairs has eased down the lockdown restriction further. In a revised guideline issued by the ministry on virus-infected countrywide lockdown, it has allowed opening of all shops in residential complexes and market complexes, except shops in multi-brand and single-brand malls outside the limit of municipal corporations and also municipalities with 50% strength of the workers with wearing of masks. However, the ease down will not be applicable to the containment regions of the country. And up next, we look at some reports that inspire hope and positivity in these difficult times. Every day, we get you some reports which have that feel-good factor attached to them. India has developed indigenous production of low-cost testing kit with 100% specificity and also sensitivity. The real-time PCR-based probe-free kit validated by the ICMR, that is the apex medical research body of the country. Now, the detective assay has been developed by IIT Delhi research team, and it comprises of postdoctorates and professors. The 10-member research team has successfully identified the unique regions in the genetic material of the virus which were not present in its earlier variants. Further, the diagnostic assay uses the fluorescent dyes instead of the fluorescent probe, which helps to scale down the price of the kit.
ये सबसे बड़ा इनोवेशन है क्योंकि इससे कॉस्ट ऑफ डिटेक्शन बहुत कम हो जाएगा. आप 300 रुपीज़ 400 रुपीज़ में अगर किसी को टेस्ट कर पाएंगे तो आप उसको स्केल अप कर पाएंगे, आप बहुत सारे लोगों को टेस्ट कर पाएंगे. अब इवन IITs में भी, एकेडमिक इंस्टीट्यूशंस में भी हम यही सोच रहे कि जब स्टूडेंट्स वापस आना चालू करेंगे उनको टेस्टिंग प्रोटोकॉल्स चाहिए, उनको टेस्टिंग करने का बहुत ज़रूरी है. सो आई थिंक विद दिस सॉर्ट ऑफ लो कॉस्ट टेक्नोलॉजीज now we can start testing more people
For all the other ICMR approved technologies, they use a fluorescent probe. So we are trying to eliminate that chemistry because of two reasons. One, the fluorescent probe is an expensive component. Second, it's in short supply or demand right now. So what we did was we tried to do an alternative chemistry which does not need a fluorescent probe.
At this difficult time, the Corona warriors are getting active and unprecedented support from some individuals who are not only contributing in the ongoing fight against COVID-19, but are also setting examples for others to follow. In one such inspiring example, Hostel Girls in Jammu is making masks for the frontline workers. The girls of all ages are working tirelessly to make masks in large quantities so that the masks can be distributed to those who are working to keep us safe. And also, Chandigarh Police has taken a unique initiative. A health team has been formed by Chandigarh Police to take care of the health of police personnel at their posts and also conduct a preliminary check on their health. The health team of the paramedics, along with sub-inspector, is checking up about 100 to 150 policemen posted at various posts. This health team is connected to the doctors of the police hospitals through tabs for consultation if needed. Now, the doctors of the health team may prescribe medicines to the police personnel or advise them rest. Also, police personnel can call the hospital for any further investigation. It is indeed a great initiative to boost the morale of police personnel who are doing long hours duties to fight COVID-19.
जो कि सिपाही हमारे आ नहीं सकते बाहर वहां से अपनी जगह छोड़ के, तो हमने टेलीमेडिक्स भी शुरू कराया है ताकि वो थ्रू डिजिटल मीडिया डॉक्टर्स को हमारे हॉस्पिटल्स में कंसल्ट कर सकें और यदि उनको सिम्टम्स हैं तो उसको वो ठीक करवा पाएं अपनी दवाई लेके. एटलीस्ट दे विल हैव सम एक्सेस टू द डॉक्टर.
And migrant laborers and homeless have been the worst affected due to the ongoing COVID-19 lockdown. To ensure migrant laborers and homeless people earn living after the lockdown, Nagpur Municipal Corporation has taken a unique initiative. The authorities are imparting skill-based training where stitching is being taught to women while men learn technical works including making solar pumps. And when people are counting days for the lockdown to get over, here is someone who seems to be enjoying the lockdown days and is not fearing police stopping him from roaming freely around on streets, violating all guidelines. Now, Padayappa, the elephant. The people of Munnar region have nicknamed the elephant after Rajnikant's starrer movie Padayappa. Keeping their love for the Kollywood star alive, the elephant Padayappa is also not getting involved in much mischief of late. Rather, he seems to be enjoying walking on the empty streets of Munnar, stopping at times near the plantain farming to have plantain leaves and bananas. Now, though people feared the tusker initially, he has now become a regular visitor and people call out his name aloud from distance as well. All right, up next, we'll scan through the developments from across the world in our segment World Wrap. The worldwide death toll from coronavirus pandemic crossed 1,95,900 with nearly two-thirds of the fatalities in Europe only. A total of 1,95,920 people have died and 27,90,986 people have been infected since the virus emerged in China in December. The country with the most deaths is United States with 51,017 deaths, followed by Italy with 25,969 deaths. The death toll in Spain stands at 22,524. In France, 22,245 deaths were reported, and in Britain, 19,506 deaths were reported. The world leaders pledged on Friday to accelerate work on tests, drugs and vaccines against COVID-19 and to share them around the globe, but the United States did not take part in the launch of the World Health Organization's initiative. French President Emmanuel Macron, German Chancellor Angela Merkel and South African President Cyril Ramaphosa were among those who joined a video conference to launch what the WHO had billed as a landmark collaboration to fight the pandemic. The aim is to spread development of safe and effective drugs, tests and vaccines to prevent, diagnose and treat COVID-19, the lung disease that is caused by novel coronavirus, and ensure equal access to treatment for rich and poor. Leaders from Asia, Middle East and the Americas also joined the video conference, but a spokesman for the U.S. mission in Geneva had said that the United States would not be involved. The Spain government has declared an end to the most acute phase of the epidemic in the backdrop of the lowest death toll in more than a month. However, with 22,524 deaths in total, Spain still has the world's third highest tally after the United States and Italy. The government has already taken some steps to relax the lockdown, but border restrictions will not be eased until late May. Belgium Prime Minister Sophie Wilms has announced gradual easing of the lockdown restrictions from May 4th, with a series of phases of further reopening during the course of the month. While announcing the lockdown, the Prime Minister said that the country would need to carry out 25,000 to 30,000 tests per day to withdraw from the lockdown. Currently, Belgium has 44,293 confirmed COVID-19 cases and 6,679 fatalities. And green activists placed rows of boats and shoes in Zurich Square to take the place of protesters who normally come out in person on Fridays to demand action on climate change. Organizers said that they wanted to make their point while respecting curbs on public gatherings imposed to contain the novel coronavirus, which has killed more than 1,300 people in Switzerland. Last year was the hottest on record in Europe, according to a study released by European Union's Copernicus Climate Change Service. In Argentina, inmates at a prison in Buenos Aires set fire to mattresses and protested on the roof of the jail. They are demanding the release of inmates at greater risk of contracting the coronavirus. "We refuse to die in prison," a banner hanging from the side of the jail read. The riot initially began late on Thursday after prisoners learned that a number of people in the facility were infected with the virus. There was no official information immediately available on any injuries or fatalities at the jail, which houses over 1,600 inmates. Argentina, which imposed a tough nationwide lockdown in mid-March, has registered a total of 3,435 confirmed cases of COVID-19 with 167 deaths. And FIFA will release operational funds for 2019 and 2020 amounting to $150 million to its member associations as the first step of a relief plan to help negate the economic impact of COVID-19. Each of FIFA's 211 member associations would receive $500,000 in the coming days, as well as any remaining entitlements for 2019 and 2020. FIFA president has raised concern on the unprecedented challenges faced by the entire football community due to the pandemic. He said that as the world governing body, it is FIFA's duty to be there and support the ones who are facing acute needs. FIFA would immediately release the second installment of operational costs for 2020, originally due in July. And now let's listen in to experts on COVID-19.
As far as immunity to coronavirus is concerned, we do not know as of now how long the immunity is going to last. Definitely, IgM antibodies develop around the 7th or 8th day following infection, and they are replaced by IgG antibodies around the 14th to 15th day. In fact, this is the basis of plasma therapy which we are given, that is preformed antibodies.
So those were the words of advice coming in from our expert in our segment, Doctors Speak. And also, as the Ramadan month begins today amidst the lockdown, former cricket player Irfan Pathan has greeted everyone on the occasion. Let's take a look.
सबसे पहले रमज़ान मुबारक। बहुत लोग बात करें कि ये जो रमज़ान का महीना है ये बहुत मुश्किल से गुजरने वाला है, ये रब की तरफ से एग्ज़ाम है। एग्ज़ाम नहीं है मेरे भाई, ये मौका है अपनी इबादतों में बढ़ोतरी करने का। हम और आप हमेशा काम में बिजी रहते हैं और जब काम में बिजी रहने के साथ साथ रोज़ा रखा जाए तो सबको पता है कहीं ना कहीं कुछ कमी रह जाती है इबादतों में, लेकिन इस बार ऐसा होने वाला नहीं है। लॉकडाउन है, घर में रहने वाले ज़्यादा से ज़्यादा नफिल नमाज पढ़ने का मौका मिलेगा तो नमाज पढ़िए। ज़्यादा से ज़्यादा कुरान शरीफ पे तवज्जो दीजिए, ज़्यादा से ज़्यादा इबादत करने पे तवज्जो दीजिए, सवाब कमाने में तवज्जो दीजिए। मुझे नहीं लगता इससे बेहतर रमज़ान न कभी आया है न कभी आएगा। अगर उस सोच के साथ चलेंगे तो ये रमज़ान का महीना बहुत खूबसूरत तरीके से जाने वाला है। खूब दुआ करिए आपके लिए, हमारे लिए और पूरी दुनिया के हक में। रमज़ान मुबारक।
All right, so those are the words of wisdom coming in from Irfan Pathan. On that note of positivity and optimism, we'll end this edition of Tracking COVID-19 here. Thanks for watching. Namaskar.